Karthik, you started
Yes.
your live program. Now live program has been started. You please
Yes.
send me the link. Send me the
Yeah,
and
yeah.
please
I'll send you the
send
link.
a
I'll
link.
send you
I
the
love
link.
page homeopathy. It is going to
Yes,
the I
yes.
love page. Okay.
That's right. Yeah, yeah.
What is the full name of the page?
I'll send you the link now, doctor.
Link. Okay, okay. Just for a few minutes. Another 3 minutes. We'll start the program. www.youtube.com slash wait ch. There is the link. Okay.
Yeah, that's the link.
Please send me through the WhatsApp.
Okay.
Sir, hello. Dr.
Any
Khan, sir.
problem, madam?
Just 1 second you wait. 1 second, sir.
Just okay, okay, okay. Please wait. We'll start at 5:05. So many people from Bangladesh.
We have 550 members of our
Okay, okay, okay. Let
Wow.
them join. Let them join.
Okay.
Okay.
Maybe we should do one separately for them, Dr. Kalyan.
Thanks.
Dr. Kalyan, he is Dr. Karthik Raghava Murthy from Chennai. He is the CEO of the Bahula Foundation and Research, Bahula Laboratories.
Okay.
One of the oldest manufacturing unit of India after HAPCO, 80 years old. Its manufacturing unit is manufacturing
After
unit is
HAPCO.
after HAPCO, it is oldest one. Its manufacturing unit is situated at very beautiful place at Pondicherry. Very beautiful place. It is a holy place for us. At Pondicherry.
How many participants here?
Now participant is just 67. It will increase probably.
Okay.
69, increasing. Time is passing and increasing.
Today also it was our exam, na, sir. Third year exam.
Third year exam, university exam. Probably.
Yes. So just now at 4 o'clock the students has been released from the college.
Okay.
BHM is third year. BHM is third year.
Yes. Third year
BHMS
organ.
university exam.
University exam was there.
Okay, Dr. Kollan, she is our principal madam. Dr. Meena
Good evening,
Suma
sir.
madam is the principal.
Yes, good evening, sir.
Dr. Kollan Sur and Dr. Monjira Sur will be our speaker on the mind technology.
Yes.
Now, Karthik, it is live program is going on.
Yes,
Karthik,
live. I'm just going to start
you
recording
please start
now.
the live. Now it is 5 past.
It started live. We are already live on YouTube.
Okay. Good evening, everybody. Good morning, everybody. Good evening, good afternoon, whatever might be it. So many people are joining from the different part of the world. So we would like to start our webinar. This is the last webinar of this year, 2020 last webinar. Since long time, we are conducting webinar, virtual workshop through the link as provided by the Bahula Foundation and Research. And this is the last one today, which two prominent speakers from West Bengal, Dr. Monjira Sur and Dr. Kollan Sur. And they will deliver their lecture in the first session. In the second session, Dr. Biswajit Basu will take part at 6:30. Both Dr. Sur, the Surs, both are very much renowned in the field of homeopathy. They have introduced a very beautiful technique for the mind technique. Dr. Kollan Sur is the founder of the School of Homeopathic Mind Technique. And since long time, she has been practicing in homeopathy at Kollani area of the West Bengal, and very good practitioner, orator in the field of homeopathy, and innovative ideas. And many people may say that it is nothing but extract of a Sehgal method. So many people say it is the extract of the
Yes,
Kent's
yes.
method, whatever may be it. And he has developed a lot for the people, for the students, how to understand the mental rubrics and how to apply it in practice, by clinical practice. And owing to his contribution, our obviously our students will be benefited from his lecture, from his case studies and others through the mental rubrics and others. Mental general at the first grade general, as we know, the Kent has given more importance. Even Hahnemann too gave emphasis on the mental symptoms. Dr. Soor did BHMS from a renowned college of India, that is the Calcutta Homeopathy Medical College, hospital most oldest college in Asia, wherein I pursued my studies in BHMS course as a first batch of BHMS under Calcutta University. So I congratulate, welcome Dr. Soor, Dr. Golan Soor, and another speaker, his wife, partner, life partner, Dr. Manjira Soor. She took graduation course from DND Homeopathy Medical College and Hospital, wherein I was in administration for a long time as the principal administrator of these institutions. So I welcome Dr. Manjira Soor, and she also delivered on different cases, surgical and medicinal cases, and through the mind techno. She is the president of that institution, that school of homeopathic mind technique, and the founder is our Dr. Soor. So, and Dr. Soor will speak on the multi-organ failure and the acute emergency cases. I request Dr. Suma Madam to start this program. Dr. Suma
Okay.
Madam. Okay,
Yes,
okay,
sir. Yes, yes.
okay, okay.
Once again, good evening to all. Once again, we are meeting today in one of the happy and the pleasant evening. As usual, today also we have arranged one of the good workshop. The three speakers are there. That all the three speakers are very eminent speakers are there. And first speaker is Dr. Monjira Soor. She is the president of the School of Homeopathic Mind Technique, and she will speak on surgical and medical cases. So I welcome to Dr. Manjira Soor ma'am on behalf of Antar Bharati Homeopathic Medical College. Another eminent speaker, that is Dr. Kalyan Kumar Soor. He is the founder of Homeopathic Mind Technique, and he will speak on multi-organ failure. The really good topic is there, sir. And I welcome to you also on behalf of our Antarbharti Homeopathic Medical College. The third speaker he will join, as per Dr. Khan, that he will join at 6:30, I think. So
Yes.
Dr. Biswajit Basu, sir, yeah, he is the very popular personality, which is I always listen his lectures on the YouTube. So I think he is the hero of the YouTube. Many lectures I have, yes, many lectures I have listened and I attended on this YouTube on Matra Medica. He is the chairman of Bengal Academy of Applied Homeopathy. He is also topic on the bedside experiences, and all the three topics are very useful for our day-to-day practice. So I welcome to Dr. Biswajit Basu, sir. Again, I welcome to all the three eminent speakers, and I'll not take that much time. All the best to all these three, sir. All the best to ma'am and sir also, and best of luck to Dr. Biswajit Basu, sir. And in advance, I will give you the happy in advance happy new year, sir. And
Well,
I declare the today's session you can start. Thank you, sir.
thank you, madam. Thank you, madam. Thank you, madam. Okay, viewers, now the 100 crossed, 102. Now it is going on
Yes, yes,
102.
very nice, sir. Very
Okay,
nice.
102. So many people have joined from Bangladesh, West Bengal, and different part of the country, and also
Yes.
abroad.
Mm.
So, Dr. Soor, can you hear me? Dr. Soor, please start your program. Dr. Sur, Dr. Kollan Sur, and Dr. Monjira Sur, please start your program.
Good afternoon, everybody. I'd like to pay gratitude to the founder director, Dr. M.G. Jite, convener, Dr. V.C. Gore, principal, Dr. Meena Sambha, superintendent of HMCH, Dr. Prasant Varvat, CEO of Bahola, Mr. Kartik Raghava Murthy, and Professor Dr. Akhilesh Khan, Professor Emeritus and Mentor of Antarvarti Homeopathic Medical College and Hospital, Dhaba, Nagpur, and Bahula Foundation for Homeopathic Research and Foundation. I would like to pay my many thanks to Dr. Akhilesh Khan for giving me and for inviting me the opportunity from my experience. It's a great honor for me to attend this virtual workshop. I'd like to pay my respect to my co-speakers and all respected and esteemed doctors who have joined this workshop. Now we are going to establish or going to show you some cases within our time depends on the mental state only. What is a mental state? That is, on the mind section of the repertory, we depend on the mind section only. And if you judge the mental symptoms and collect the mental symptoms minutely, you can assess his or her mental state. And depend on the mental state, you can prescribe the good medicine, and the patients must be cured by that. So, what are the points we want to know? As we are the newer in this today's workshop to you, that's why I want to know all of you that the few points briefly how we take the case depends on the mental symptoms or judge the mental state. Treat the patient with the help of mental state only. That is a rubrics taken from mind section of the repertory. We use mainly the synthesis in this respect. Synthesis repertory. There are three vital points we have to judge. That is present, predominating, and persisting. What is the present? The patient is telling in front of you. You means your doctor in front of you. This is a present. And predominating what the patient is telling in front of you. Out of that, what is the predominating symptoms? You must assess. And persisting, what is persisting? Persisting is what symptoms are going on. That is, he may carry the symptoms, and in front of you, whenever he is telling in front of you, that symptoms is, say, he's telling about the symptoms. There are so many words, but within this time, I want to express this by some few points and expressing each of the points with the examples of the patient. My view is that whenever you read a rubrics, you must read the every word of that rubrics with a literal meaning, that is a dictionary meaning. And after that, you must imply that word to your patient. That is suppose patient is telling in front of you that is he has some fever, but how he is telling and what in what aspect, like that you must assess that one. So You must take the present mental state, present symptoms, and what is the predominating of that case. And I want to tell the cases is that after finishing all my points and the persisting, the next and very most important one is we must ask the patients about these points: when, how, what, and why. When the patients will come to your chamber, and how he has come, and what is his symptoms, what he is telling about his problem, and why he has come. Either he has come to a chamber for himself, or his family members forced to send him to a chamber, or his official persons ask him that why he is so many days absent for his job. After hearing this, he has come to a chamber. So there are different rubrics there. Whenever we teach, I can talk about that rubrics, I must tell you. This is the points that are before 3 points and then 4 points. Among these points, judge, and then you judge the mental state of that patient. There are another points. After selecting the rubrics and giving the medicines to the patient, some complain that there is a discharge will start. But I here write down that if you have the correct prescription, the discharge is abnormal discharge. There is discharge that is like the urethra and anus, that is urine and evacuations, is a common discharge, normal. This is not the fact. Our point is that abnormal, I have write down here, that is abnormal discharge comes out from any 5 natural outlets, that is from nose, mouth, urethra, anus, skin, may come. Or sometimes I said may because sometimes patients are aware about this. Patients have noticed this. Sometimes the minimum symptoms is there. Patients are not noticed about his or her problems. So suppose nose. After giving medicines for the migraine, patients complain that I have severe nasal discharge, severe watering from my nose. I can't maintain my job. I am a receptionist of an office, so it is impossible to me to continue my job as a severe watery discharge from my nose, like that. But you think that your prescriptions is, if you have the confidence about your prescriptions and the patient feels better, patient told you that I'm feeling better about my migraine complaint, that time you think that your prescription is correct one, and you may give the placebo like that, and you know the placebo is a good prescription. And next one is the mouth. After giving some complaint of the patient is complaining that there's a vomiting started after taking the medicine, but I have no vomiting complaint before that, before taking the medicine. So you think that my medicine, my prescription is a correct one, and you must wait and watch and give him the placebo. Urethra. Urethra is a normal, passing of the urine is a normal one. But if the patient complaining that after taking my medicines for the gouts, joint pains, the paining of my knees, several times I want to go to the toilet, even in the night also. I can't sleep, but my knee problem is better than previous, and I can't do my job, household work before taking the medicines properly, and now I can. I am better than previous, but I'm passing so many times to go to the toilet, and it is very I can't do this. It is a very bothering to me. But you know that it is a good sign. And Anus, patient is complaining that after taking the medicine, there are a patient is passing stool several times and consistency is bad or worse than the previous. And what about the skin? After giving the medicine for the respiratory complaint, patients complaining that I have a skin eruptions, which was not, but now I have. Or patient may complain that after taking the medicine, there's a high rise of temperature. I have no temperature. I am not feeling sick off and on, like fever and something like that. But after taking respiratory complaint medicines for this, there is a high rise of temperature. But you have the confidence, you have the confidence about your prescription, you must wait and tell the patients about that this is a natural phenomena and you may take this one, that is you may take this placebos. But one thing is that how many days you can wait. This is my next slide is this abnormal discharge appear on the odd number of days, that is on the first day, third day and fifth day. It persists fixed period of time, that is fixed number of days, hours and minutes. Next one is goes to the peak and then gradually decrease. And one of the most important that in spite of this discharge is going on, patient tells you that if he feels better as discharge gradually comes and goes off. I missed here, that is gradually comes and goes off. One main thing is that patient feels better. That is, a patient is mentally better than previous. This is the criteria I have to consider when we going to prescribe medicines for patient. Now, I'm telling a short case that is now we are facing the COVID-19. On this pandemic situation, most of the persons, either medical or non-medical persons, know that what are the symptoms about the COVID-19. So on the basis of that, I want to tell you on short case. During this pandemic, once morning, one of my patient, 25 years, smell. I'm not observing you the video cases because it takes too much time. So I'm telling the cases shortly. He called me once morning that, ma'am, I am very sick. I said, why? What happened? He said that for the 4 days, I am suffering from fever. And I took some medicines. Beside my house, there is a shop is there. And I took some antipyretic medicines like that. After taking the medicines, the temperature comes down for the 6 to 7 hours. And then it goes high. I think, and the shopkeeper also told me that at least 3 days you must tolerate, and after that it goes off. But from the yesterday morning, I feel very sick. I have the severe headache. with throatache. And you know, I have a nasal polyp from my childhood. And from yesterday morning also, I can't get the proper smell of my food. From that point, from the yesterday morning, I confined myself in a room, and my family members served my food within the room. And with that room, there's a attached washroom is there. So I use that one. But after that, after taking some antibiotic also, there is no solution was there. I think that I am attacked by the COVID-19, and I think that I must call to the, if the problem will not solve by you, then I'll call to the health personnel nearest to my house, and they will take me, or I'll call to the police. They will take to me to the proper places. I said, why you are you are telling like this? He said, no, I know the symptoms of the COVID-19. One of my friend was affected by this, and he had the symptoms. And my symptoms is similar or same to that. I said, these symptoms may be due to the simple viral infections also. And you have the nasal polyp from your childhood. And from that, after getting the cold, catch and cold, nasal polyp will increase, and you may not take your smell from the nose. So what happened? Think positive, and this may not be the COVID-19. But in spite of this, in spite of my conversations, he said that, no, man, I am definitely suffered with the COVID-19. And if you have any solutions, please give me the medicine. And if may not, I must call to the health personnel and police and like that. This is the case. And after hearing all the symptoms and assessing the mental state of the patients, I select the rubrics, that is fear superstitious. You must not select the rubrics line by line, word by word, what the patients will tell. You must assess the mental aspect of the patients, mental state of the patients, what he wants to tell. If you take the rubrics word by word, it is not the good one, good prescriptions. But on this method, we must select the rubrics depends upon the mental state only. And for that reasons, it may be single rubrics. Whenever the single rubrics is selected for the whole of the cases after the judgment. So, on this case, I select this fear superstitious. Why fear and why superstitious, I want to tell you. What is the meaning of fear? Fear is an unpleasant thought caused by something dangerous, painful, or bad that is happening or might happen. That is unpleasant thought. What is unpleasant? Patient was pleasant about his patient was satisfied about his problem because he used to take the medicines for antipyretic from his nearest shop. But whenever he started his throat problem and he cannot, that is anosmia start, that time he thought that is he was suffered by COVID-19. That time his mind is the unpleasant thought. Why? I have written here, caused by something dangerous. Caused by something dangerous, and that is a painful or a bad that is happening or might happen. That is happening. He is suffering from this. And if he has the COVID-19, that's why he confined himself to his room. That is might happen. Can I share my slide with all? Sir, Dr. Ock.
Yes.
Okay, thank you. And next number is mixed feeling of dread and reverence. He is very much feared about his problem. And why this is a reverence? Where is the reverence? He is reverent about his family and about the disease, because he know that if there is a family members, his father and mother is there, and he know that aged persons are affected much more, and if they are affected, they will affect, it will be the dangerous, more dangerous for them. So he must reverent about his disease. So that's why he want to confine himself within a room. And that's why he wants to go to the outside for curing himself. So he must reverent about his family, and he must be reverent about the disease also. Next one is superstitious. What's the meaning of superstitious? That is ignorance about scientific knowledge. And next one is excessively credulous belief in. And next one is reverence for the supernatural. Ignorance about scientific knowledge. Where is the ignorance here? Patient is non-medical person. So he must not be aware about the other diseases like the symptoms of the COVID-19. So whenever the symptoms will appear, he thinks that is this one due to the COVID-19.
Online meeting.
And excessively credulous believing what he is thinking. He thinks that if this is the correct one, and he is credulously believe his thoughts. There is a no judgment, nothing is there. And reverence for the supernatural. He is reverent. It is a disease, infectious disease, and he is reverent about this disease. That's why he wants to cure himself, and he wants to save his family members, especially the aged one. That's why he is reverent about his family and about the curing of his disease. So superstitious is a correct one on this aspect. And fear superstitious, you know, that is on single synthesis. I used to do synthesis 8 point. So there is a superstitious fear. Superstitious only one drug is, I've shown you, that is Rastrux 30, 3 doses. Rastrux 33 doses. So after taking the Rastrux, fever was there. It takes little time, or 6 hours, 6 to 8 hours, but the patient is mentally well, and he is well about, because he told me that after 3 hours he called me and told me that, ma'am, I am feeling well. I think it may not be the COVID-19. So you please give me more medicines and I'll take your medicine, and that's why, and that way I must be cured. So see that case, he is mentally okay, mentally he is free, about that belief. That's why I took this case, only the fear superstitious, only single rubrics and single drug, and that cured the patient. Next one is a case of osteomyelitis. You know that osteomyelitis is an infective disease, infections in a bone. Infection can spread through bloodstream. Causes of osteomyelitis is a staphylococcus bacteria, which enters through the bloodstream, commonly found in the skin or in the nose, on even in healthy individual. But whenever it affects the person, the common site of osteomyelitis is the long bones, pelvis, clavicle, having the symptoms of redness, pain, swelling. It needs emergency management. Prognosis is very bad. If it is untreated, goes to sepsis. Some hospitalized patients may suffer from osteomyelitis due to infection entered through the catheter also, through the IV channels, those who have stayed long times in the hospital, or through the surgical wounds. And if it is untreated, the complications of the osteomyelitis is, that is a fracture of the affected bone. There are two types of osteomyelitis, that is acute and chronic one. Acute takes 2 weeks to bone infections, and chronic takes 6 or more weeks for take the infections. It causes bone destruction, bony destructions, and formation of the sequestra. Formation of the sequestra. So this is a brief aspect. Whenever any pathological and medicinal case I want to describe, I want to tell some pathological aspect or medicinal aspect of that disease, and then I want to tell the rubrics about that. I want to show you the still pic of that patients who had suffered by osteomyelitis of his right foreleg. You see that after suddenly seeing that it's like a punched out ulcer. That something, some discharges coming out, and deep ulcer is there. This is shin bone. So you know that there is a less musculature on the bony aspect. And if it takes untreated, it may fracture that part. After taking the medicine, granulation tissue comes out. After some days, some months, or some days, after some time, see this one. So I want to tell about the case. A 45 years old woman came to my chamber having the problem that pain in his leg. wrapping the bandage in his foreleg, in her foreleg. She said that few days ago she had suffered a pain in her leg with some redness and much swelling, a little bit swelling was there. She thinks that some blunt injury was there. So she put some ointments or some cold compressions like that. But after that, she thinks that is some insect bite was there. But after a few days, she noticed that something is comes out from that point. Then she, after giving some antiseptic lotions, she wrapped properly dressing and she wrapped that part. 2 to 3 days she lived there. But the day before yesterday, when which day she came to my chamber, after uncovered that wrapping, she noticed that there is a small hole and some discharge is coming out. This is the case, and then she came to my chamber. After coming, she told me that like this way, ma'am, please see my part, why it is occur and when and how. There was a simple red spot was there, and I put some medicines and some cold compress, etc., etc. But today morning when I removed my bandage and gauze like that, I noticed that this some small hole is there and some discharge is there. Yesterday and today also I noticed. But why it is? How it will occur? This, she is telling like a charging way. And she also told me that previously you gave me on other complaint, so good medicines was there. That's why I want to come to you for this complaint to treat for the treatment of this problem. But I can't expect this. This nothing was there, and why it occurred? See, as if I will give a big hit to her leg, and that's why she was suffering from this. And after that, she told me that. Then she told me, give me some medicines, because whenever I had a bad migraine, you prescribed me the good medicines, and after taking the medicines within 1 hour, it was abolished. But and the next time, whenever I had the severe abdominal pain at that night, and you also prescribed the good one, and I also relieved. But I think this is a simple one. This was a simple one. There is a simple redness, simple swelling, and slight pain was there. But yesterday and today, after removing my gauze, I am very much astonished that what happened. So give me some medicines before that. I want to show you you see that after giving the medicines, the granulation tissue comes out from that wound. I took the rubric that is shrieking help for and delusion help calling for. Two rubrics I took. What's the meaning of shriek? It is a high-pitched noise. What I have write down here, that is high-pitched noise, not the sound. What is a noise? Noise is a sound that is a disagreeable auditory experience. That is the disagreeable auditory experience. You have the disagreeable experience. You can't expect the patients, that is, she or he will charge you why it is occurred, how it is occurred, charge you. He or she may ask you how it occurred, but they can't charge you. They may, but this is not the agreeable one. So that is I took the rubric that is shriek, shrieking help for. Shrieking help for. Next one is, I want to describe the help, but next rubrics I wish to go. That is a delusion help calling for. Next one. So shrieking help for, there is a help is there. So we must know that what is the meaning of the help. We know every help is what is the meaning of help. But in the mental aspect, you must know much more than the previous one. That is, help means give assistance. That is, she was trying by applying some ointment, by applying the cold compress and like that, or dressing that wound area, but it was not relieved. That's why she want some assistance. Who is the assistant? She thinks I will be the assistant. Next is change for the better. Now she is, at that time she was our positions, but she wants to change her positions for the better respect. And the next one is contribute to the furtherance of. That is next one. She wants to contribute it and make it easier. That is, make it the previous one, make it the healthier one. That's why she wants to help me. But previously, firstly, he shrieked, help me with a shrieking voice. So for that reasons, I took the shrieking help for. And the next one is, after that, she told me that you have cured my other cases, other complaint previously. So give me some medicines for this cause. So this time she wants to help from you. So that's why I took that is delusion help calling for. And the next one is, what is the call? I used to tell you that I wish to teach that rubrics in every word, and then I must be explain that word which is applicable on that cases aspect. What is a call? Call is assign a specific name to. She's calling me. She wants to calling me. She came to me for relieving purpose or relieving her complaint. Try to get into communication. But she's calling me for communication. In mental aspect, there are so many rubrics that they are similar but not the same. Communicate, talk, speech, all are rubrics. So communicate. What is a communicate? Transmit thoughts or feelings, interchange information or ideas. That we are communicate with each other. Now we are participating in a virtual workshop. So we are communicating with each other. And last one is indicate our decisions in regard to. Indicate decisions. She wants to take a decisions whether she wants to, she came to me for get rid of of her problem and asked to come. That's why I took the rubric that is delusion, help, calling for. I gave platinum 33 doses. And you've seen that after taking the medicines, after some times, the patient is cured. And as the osteomyelitis is an acute emergency case, so in spite of this, after giving the platinum, only the 3 dose, it was cured. For selecting the 2 rubrics. And the next one is so there is time is too short. That's why that's why
Continue.
Okay, thank you. This is the last, I think, because
Okay.
Dr. Shuri is waiting. So there is one small case, short case is there. That is fear extravagance. You know, on the mental aspect, fear extravagance has got the various meaning. On the perspective of a patient's view and on the perspective of a case, I want to express. One 55 years old woman came to my chamber having the problem of both knee joint pain. She told me that I have pain in my joints. I asked her, that is, knee joint pain is not the 1 or 2 days or 1 or 2 hours or 3 days or 5 days like that. To whether she was affected by that both joints. She told me that it was paining for several months, and she is a housewife and used to do the household work properly. She said that I am very much tidy. Mind that point. You must judge the mental state, not the symptoms. Whenever she told that I am tidy, you write down the tidy and responsibility and like this. No, fastidious, no. She told me that I am tidy, but for the few months, I think that I can't do my job properly. I asked her, that is, so, okay, no problems. You may help with your maids or other family members. She told me that, no, their work is not so good. They are very unclean way they work. I don't like them. I used to do that. Then I think that why she had come to me. I asked him also. She said that for the last 7 days, the pain is more. And I said that, for that pain, what treatment was going on? She said that I took some painkiller, and after taking, I was okay for the 3 to 5 days, and then again I used to take that. I asked her, that is okay, no problem, you may take. She said, no, ma'am. For the last 7 days, I took the one painkiller and it will persist the effect for the 3 to 5 days. But last 7 days, I took twice daily the painkiller, anti-analgesic, but it was not working as previous. And from the yesterday, pain was severe, and no anti-analgesic high power was acted. I can't stay properly. I can't use my personal work. I can't use the washroom properly. I must help with the other family members. You see now, that is whenever I come to your chamber, I can't walk properly. The pain is so much that it crosses my threshold level. I can't tolerate this pain. There's so much paining at present. And today is your chamber date. And tomorrow you will not hear. And if the pain will be much more, how can I use how can I use the washroom, or how can I maintain my personal work? So I took the rubrics here, that fear extravagance. I have also told that about the fear, and now I want to tell that what is extravagant and why I took these rubrics in this case. Fear extravagance. What is extravagance? The meaning of extravagance is the quality of exceeding the appropriate limits of decorum, and exceeding what is reasonable or appropriate. That is, she told me that I cross my threshold level. I can't tolerate the pain. Previously it was, but now from the yesterday it is intolerable to me. And the next is, why it is fear? She is very thinking about that tomorrow I will not be there. So that pain is so much, if she will not face me or not getting me tomorrow, the pain will much more, and that time it was many problem. There will be many others problem, much more problem about to maintain herself. That is her personal work also. That's why, after thinking that, she's very much fear. So that's why I took the rubrics fear extravagance. So after hearing the whole case, what is the mental theme here? What is the mental theme here? That is the whole case, patient is very much fear about her problem, and that is extravagantly. So I took the single rubrics, that is fear extravagance. And the opium, I gave her the opium, prescribed her the opium, 33 doses. And after taking the opium, it comes down. And after that, there is a placebo was there. And beside that, I advise that women, that patients, that please reduce your weight, as these are the most weight bearing joints. And whenever the fatty patients is there, it will be the most problematic to the patients. So after that, the pill, taking the pill, and she is much more better, and gradually it is lessening her pain. So I took so much time, and I am very glad that all the respected and esteemed delegates and organizers, and in front of me, that is Dr. Professor Akhilesh Khan is here. Thank you very much, all of you, and thanks to all, and stay safe and stay healthy and for this COVID situation, and thanks for the coming Happy New Year also. Thank you once again.
Thank you. Please stay with us because we have some questions that we'll put down before you after the panel, during the panel discussion. There will be a panel discussion.
Okay.
Already 2 questions have been put down by Dr. Professor Subhamoy Ghosh of Howrah Moaz Bhattacharya Homeopathy Medical College. And we'll come to that questions after the lecture of Dr. Dr. Basu during panel. Please stay with us. Now we have another speaker who is a founder of this mind technique, Dr. Kollan Kumar Sul. Dr. Kollan Kumar Sul speak on some emergency cases, how to deal with the emergency cases by considering the mental rubrics. Dr. Sur, please start. Dr. Sur, please start. Dr. Kollan Kumar Sur.
Thank you.
Okay, please start your program. He is the founder of the mind technique, and he will now speak on the point of emergency cases by considering the mind rubrics. Okay, please start.
Thank you.
Okay.
Good evening and welcome everybody. And it is my pleasure, Dr. Akhilesh Khan, Professor Akhilesh Khan, give me the privilege to attend here. Thanks to my elder brother and also Dr. Professor Akhilesh Khan. He is my senior brother of my college. Thanks everybody, and thanks to all my learned audience. I, Dr. Kollan Kumar Sur, the founder of the School of Homeopathic Mind Technique. I will present here a very devastating case, life-threatening case. The patient was suffering from viral encephalitis, type 2. Patient was admitted in Shromojibi Hospital, Howrah. Viral encephalitis, this case was diagnosed by the medical board of that hospital was secondary encephalitis type 2. It is due to faulty immune response of the patient, also known as post-infective encephalitis. After the infection, 2 to 3 weeks after the infection, the symptoms will start. And you know that every symptoms of this encephalitis and prognosis is very bad. The patient was in hospital 15 days in ICU. All the doctors of her medical board declared to take her home back. They have nothing to do. They declared, I'll show you the discharge certificate. This was a case of post-herpetic infection. Watch the patient. She is in total life support in ICU, Shromojibi Hospital. Mind it, the first day of video taking was 15 days after admission. The patient was in ICU for 15 days like this way. Like this way. She was in total life support. The hospital authorities gave me no permission to take the video, but I tactically took it. I have a hidden camera. By that, I captured it. This is my hand. Her daughter called her, Ma, 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 but no response. Looks like a log. You may say it is a coma vigil. Yes, complication is there in encephalitis, coma vigil. All our vital organs, brain, kidney, bladder, liver had failed. The whole day the urine output is 60 ml, 60 ml urinal output. She is now for 15 days in oxygen, catheterization, Riles tube, and 24 hours Holter monitoring. The senior matron of that ICU unit indicate me, don't take this patient. The case is gone case. According to their version, the gone case. I took the challenge. I know when allopathy fails, homeopathy will start. Only the observation, no version of the patient, no communication of the patient, only depending on observation, the mental state of the patient. As Dr. Monjira said, the present, predominating, and persisting mental state of the patient. Only observation. One of my colleague, one of my friend of Mahesh Bhattacharya Homeopathic Medical College, my batchmate was there beside me. We two are taking the case. I will repeat again. All the vital organs stopped working. All the vital organs stopped working. Multi-organ failure. Post-encephalitis.
অ্যাসাইক্লোভির পড়ছে নাকি? অ্যাসাইক্লোভির দিচ্ছে, ইঞ্জেকশনে দিচ্ছে।
ইঞ্জেকশন ফর্মে আর অয়েন্টমেন্ট।
পালস একটু ভালোই আছে। পালস? ভালো আছে। ও মাসিমা। মাসিমা,
This is my hand.
আপনার মেয়ে এসেছে তো।
I stimulated the patient.
আপনার মেয়ে এসেছে।
I told the patient in Bengali, apnar meye esheche. Your daughter is coming here. I am pinching some pins, but no response.
এর আগে একটা আরটিআই এর একটা ইউটিআই এর বোধহয় হিস্ট্রি ছিল না? এটা রেসপিরেটরি ইনফেকশন, তারপরে বোধহয় একটা ইউটিআই হলো একটা। সেটা কতদিনের মধ্যে হলো আরটিআই ইউটিআই? আরটিআইটা প্রথম ওরালি কিছু দিচ্ছেন না? ওরালি কি দিয়েছেন? না কোনো ফুড দিয়েছেন?
ওরালি মানে মুখে না, কানে রাইস টিউব দিয়ে।
রাইস টিউব দিয়ে দিচ্ছেন।
এই অবস্থার পরে।
ও আচ্ছা, রাইস টিউব দিয়ে।
Watch, after my repeated stimulation, when the patient is not responding, I told her daughter, ask your mother, ma, ma, ma. Watch it.
ফুড দিচ্ছে না, সব লিকুইড দিচ্ছে, তাই তো? আচ্ছা, তো কিছু যখন বা কিছু বলছে না খাবো না, আচ্ছা এমআরআই করো না, ব্রেনের কিছু সিটি বা এমআরআই প্রবলেম কিছু ছিল না? সিটি স্ক্যান করানোর মতো কোনো
খাওয়া দাওয়া 30 সেকেন্ডের নামে
ওমা মা
হাত দিবে
মাগো ওমা মা
This lady is her daughter. I told him, ask Ma, Ma. Obviously, there is some reason. Obviously, there is some reason.
মা আমি রত্না মা মাগো ও মা তুমি বুঝতে পারছো আমি এসছি ও মা মা মাগো মা
That time I observed, mind it, it is my observation. I observed while her daughter is telling Ma, Ma and Ma. The lips of the patient slightly moved, and the left inner canthe of the left eye was glistering. In Bengali, it is coming jol, chokher jol. The tears, very, very slight tear comes out while her daughter is asking Ma, Ma, and Ma. Mind it, while her daughter asking, that time patient does not actively responding, but only her lips move slight, very keen observation should be needed. Should be needed. Very keen observation. And the eye slightly blinked. Very slight tears in the left eye inner canthe. This was my observation. Yet no sound, no physical movement was there. After repeated stimulation by her daughter, also by me, but I observed only two things. That time, while stimulating her daughter, only lips are moving slightly for a few fraction of second, and tears glistering eyes, corner of the eyes. This was my observation. Watch the second follow-up. Next day, after taking the medicine, I gave her Pulsatilla 3x only one dose. Pulsatilla 3x 1 globules, number 10, in 5 ml distilled water. Taking that medicine in syringe, I gave her through the Riles tube. Next day follow-up. Eyes are open now.
Ma? Ma?
But no response. By external stimulation.
Ma?
Okay. Third follow-up. Watch. The right hand is moving.
দেখি হাতটা ধরুন তো
The right
দেখি
hand
দেখি
is moving.
হাতটা ধরুন ধরুন আঙুল ধরুন আঙুল ধরুন
দেখো আঙুল ধরতে পারো কিনা চেষ্টা করো মা চেষ্টা করো
ধরুন ধরো দেখি পাটা নাড়ুন তো।
পাটা নাড়ো মা, পাটা দেখো একটু পারো কিনা ভাজ করতে, দেখো তোমার চেষ্টা করো।
Lower limbs is moving.
এই পাটা পাচ্ছো দেখো তো মা, এই পাটা পাচ্ছো একটু দেখো। হ্যাঁ ওটা তো করলে, এই পাটা দেখো।
Lower
হ্যাঁ
limbs is
এটা
moving.
পাচ্ছো না, এটা পাচ্ছি।
কোথায় কষ্ট হচ্ছে?
কোথায় লাগছে মা কষ্ট, কোথায় মা? ও মা, মাথায় আছে কষ্ট? হুম, তোমার মাথায় কষ্ট আছে এখন মা? হ্যাঁ মা, হাতটা ঢুকিয়ে দেবো? ঠান্ডা লাগছে? ঠান্ডা লাগছে, ঢুকিয়ে দেবো? হ্যাঁ এটা ঢুকিয়ে দিই।
Fourth day follow-up.
ঠোঁট ভিতরে না, এই জিভ ভিতরে না।
All the life supports are removed.
না যাচ্ছি। জিভ দিয়ে আর চাটবে না, হ্যাঁ।
কি গো কিছু বলো?
মা কি খেয়েছো?
Watch the face of the patient. So changing. Remember the first day and the fourth day now.
কি খেয়েছে গো এদিন দুপুরে? ওই গলিয়ে খাইয়েছি না?
He is looking here and there. Eye movement is starting. Fifth day. He is now sitting without any support. No medicine further, no
অসুবিধা হচ্ছে
medicine.
না তো? বসছো, অসুবিধা হচ্ছে না তো? লাগছে না তো কোথাও?
Patient is
Huh?
responding to the question.
ওই জেল কোটা
হ্যাঁ কি লাগছে তোমার? হ্যাঁ কি লাগছে মা? হ্যাঁ না থাক, দাঁড়াও না, বসুক একটু। কি লাগছে মা? একটু বসা অভ্যেস থাকা ভালো, নাহলে শুয়ে শুয়ে। আচ্ছা আচ্ছা, বাইরে চেস্টটা একটা ইনফেকশন নিয়ে ভর্তি হয়েছিল। হ্যাঁ হ্যাঁ, তারপরে ওখান থেকে ইউরিন ইনফেকশন, তারপর ওটা থাকতে থাকতে হার্টবিসের সেই ভাইরাসটা গিয়ে ব্রেনে অ্যাটাক, মানে একটার পর একটা, মানে এখানেও চলছিল।
I forget one thing. There was a big decubitus ulcer on buttock. Big decubitus ulcer. They are applying steroid ointments, etc., for 15 days. But after taking pulsatilla 3x1 dose, the decubitus ulcer healed within 5 days. Believe me, within 5 days.
ভুতলে যাবে না।
6th day
হ্যাঁ হ্যাঁ
at her home.
এই জিনিসগুলো আমার ছিল না।
আচ্ছা
She was discharged from that hospital and now she is at her home.
না একদমই কিছু ছিল না তাই না?
না, পরে পরে হয়েছে এগুলো।
কি হয়েছিল আপনার?
কি হয়েছে সেটা আমার ঠিক মালুম নেই, বুঝতে পারছি না। কিন্তু
I don't know what happened, patient said. I don't know what happened. I asked her, what happened? I don't know what happened.
আমার শরীরটা দুর্বল হয়ে গেছে।
My health, I am very much weak now. Patient said, I am very much weak.
আমি কিছু বুঝে উঠতে পারি না।
I am not understand anything. At her residence,
ঘুম ভালো হচ্ছে?
হ্যাঁ, রাত্রিটা ঘুম হচ্ছে ভালো।
what about your sleep? Yes, this is fine.
দিনের বেলায় হয় না,
খিদে কেমন?
খিদে মোটামুটি আছে।
What about your appetite? Okay, that is okay.
মানে সব খাচ্ছেন তো, মাছ টাছ সব খাচ্ছেন তো?
হ্যাঁ,
You are taking everything? Okay, I am taking everything. The last video and final.
ঠিক আছে।
এখন এমন শরীর কেমন লাগছে?
শরীরটা একটু দুর্বল লাগছে, আর কিছু না।
খাওয়ার ইচ্ছা?
I am very much weak.
খাওয়ার রুচি একদম নেই, খেতে পাচ্ছি না।
Appetite is gone.
খেতে তো হবে বারবার করে। জ্বর রোজ সন্ধ্যার পরে জ্বর আসছে বলেন না? সন্ধ্যার পরে জ্বর আসছে।
হ্যাঁ, জলটা খাচ্ছি
পর ঠিক নয়, সন্ধ্যে করে অনেক সময় সন্ধ্যে।
Now my selection. This is the final. I select according to the mental state of that patient. Only mental state, no physical symptom. Truly speaking, only mental state. Present, predominating, and persisting. I took 2 rubrics from complete repertory 2019 Zomeo software. Weeping answering a question at, weeping interrupted when. This 2 rubric, only this 2 rubric. Weeping answering a question at, while questioning her daughter, she cannot answer it. That is why she weeps. How you observe her weeping? Only little tears comes out and the eyes are glistering. The left lateral canthi were glistering. That is why I concluded it as weeping. Weeping answering a question made by her daughter, Ma, Ma, Ma. And she also wept because some interruption while answering. Who feels interruption? Our patient feels interruption. In what aspect she feels interruption? In the aspect of answering. Answering the question, answering according to the stimulation made by her daughter, Ma, Ma, and Ma. She cannot make her answer, and that is why she wept. This is her interruption. रुकावत in हिंदी में रुकावत, I can't answer. रुकावत के लिए खेद है, sorry for the interruption. This is the रुकावत. I can't answer. Pulsatilla 3x, 1 dose. The patient still is alive. 7 years is running. The case was 213, now 220. Thanks all the viewers. Thanks Dr. Professor Akhilesh Khan. I will conclude my lecture here. Thanks everyone.
Excellent, Dr. Sur. Can you hear me?
Yes.
Excellent presentation. Please stay with us. After the lecture of Dr. Basu, we will call you again for the question and answer session. Please stay with us. You have questions from Dr. Subhamoy Ghosh and others. So please stay with us. Already Dr. Biswajit Basu have joined with us. Dr. Basu, please open your audio and video. Dr. Basu. Karthik, please allow Dr. Basu. Dr. Karthik. Dr. Karthik, can you hear me?
You cannot start your video because the host has stopped it.
Dr. Karthik. Dr. Karthik, please allow Dr. Basu.
Yes,
Dr. Basu has joined.
Yes.
Next speaker. Please allow
Okay,
him.
I'll just tell him.
Dr. Basu, please open your.
What is the full name, doctor? What is the full name?
Dr. Biswajit Basu is the panelist.
Yes.
Already has joined. As
Oh, he's
panelist.
here. Okay. Sorry. Yeah, he's in the panelist. Right.
Okay.
I've left him. Let him.
Namaskar.
Yes. Namaskar, doctor.
Yes.
Okay. Namaskar. Okay. Thank you, Biswajit, for joining with us. Viewers, we have another speaker, very talented speaker, very good practitioner, Dr. Biswajit Basu from Calcutta. He is the chairman of the Bengal Academy for Applied Homeopathy, and he is also a faculty member of DNA Homeopathy Medical College and Hospital. He will speak on some experiences at bedside, clinical experiences. He is a good teacher, mathematica, good orator, obviously experienced teacher, because also already we have listened him and different orations in my webinar, in our webinar in the month of October probably or August. He came with us and he has already presented some cases. So I request Dr. Basu to please go with your cases. Dr. Biswajit Basu from Calcutta. Now live program is going on. So many people have joined. The room is full now. And the people who could not join due to our capacity, they can go through the link for YouTube and Facebook Live. Dr. Kollan Sur, you please share the link to your all friends of Bangladesh. Dr. Kollan Sen, yes, already I have shared the link to your WhatsApp. They can observe, they can watch the program by Facebook Live.
Already shared.
Already you please share them because we could not able to increase the capacity now at present time. So please you share the link. So Dr. Basu, please continue. Please start your program. Dr. Basu.
Very good evening to everybody, to all participants. The Managing Committee of Antar Bharati and Bhola Foundation, especially I pay my thanks and regards to Professor Dr. Akhilesh Khan. He was administrator and principal of my college, and I have the privilege to work under his guidance during his tenure. Once again, I am also pay my thanks and regards to the organizer for giving me the opportunity to share my experiences. First of all, I am also very sorry to express my sorry that I could not join earlier, as I have had another webinar till 6 p.m. It could be better if I could hear from Dr. Kollan Sur and Dr. Manjira. I like them. They are telling beautifully in a homeopathic perspective. Especially, I do like to suggest my students to get inspiration how mental symptom can be evolved from patients. Now let me proceed to my cases from homeopathic perspective. Whether skin has been shared properly?
Yes. Yes, Dr. Basu.
Then I will detail only 3 cases today.
Okay. Please continue.
Cases with my anamnesis and all those things.
Okay.
My first case is a case of gout. It was a picture from first day visit. It is first day visit. Then what was the present complaint? I am narrating case as Hahnemann taught in Organon of Medicine, like that. And 1 second, please. Yes. The presenting complaint was in acute stage, could not step his feet with severe pain and anxiety with depression. A redness of eyes may accompany in acute stage whenever he was suffering. A last attack about 45 days ago, after 9 years before last. During acute attack, become very depressed, not like to talk, to some extent become less industrious against his common nature. Generally, he is a very industrious in nature, but whenever he is getting pain or acute attack of gout, become very much less industrious. Then, as we are taking our case as per Hahnemann's instruction, we go for fundamental cause, if any, the past history. The scabies in childhood during Bangladesh war, during 1970 and 71, and was treated with ointment and lotion. One boils on hill, treated with homeopathic medicine. Urticaria in younger age, treated and cured with homeopathy. And heat stroke about 5 years ago after an attack of chickenpox. Now under hypertensive drugs since last 9 years, initiated after a severe mental stress anxiety that also corroborates SORA in the background. A mental shock in young age, within the age of 18 to 23 years span of life, he got disappointed and grief out of death of his two sisters and father. Then the treatment history. 9 years ago, he was treated with nectam salt 200 and 1 m in suitable interval and record interval. And though there is no pain, but uric acid level stands between 6.6 to 7.4. When it was detected first about 14 years ago, with sudden and severe pain, swelling. Before that, there was no trouble. And for the first time, it was detected as 11.2. That is very important. First time, though the past history prevails and points to SORA, the presentation in the first attack, it was not like SORA. The symptom was hiding, pathology was hiding, there was no manifestation. Suddenly it comes out like psychosis. Last attack was also precipitated by mental stress and indignation. Considering acute totality, Lidam 200, 2 doses was taken and concluded with sulfur 30, following which there was no pain, but a small blackish toffee remains for last 9 years. Then family history, the paternal side, Guillain-Barré syndrome, sciatica syndrome, early death of father, grandmother died of CVA at the age of 75 years. Maternal side, diabetes, CA lung, and CKD, chronic renal failure. One of brother suffering from CVA at the age of 48 years. Another brother, elder brother, he was suffered from myocardial infarction at the age of 51. That is a strong psychosis in family. Early age and grave disease, sudden appearance. Then diabetes and mellitus and hypertension family. One important note is suicidal death in one sister from depression. That is a syphilitic and psychotic tendency in family. An early death, 22 years of one sister. And tinea infection, almost all family members, that is tubercular diathesis in family. So if we consider the past history and family history, it corroborates from the fundamental points of cause of view, if we consider both SORA, syphilis, and psychosis major. Now the physical genetics, that is appetite. Appetite is good, alternating with diminished occasionally, sometimes hunger intolerance and irritability if he feels hungry, or followed by weakness. Hurried during eating, first eating. After eating, generally feels drowsy or sleepy. Regarding desire of food, there is no significance, craving. If no certain foods may disturb her, never likes to take it. Even to drinks or eat, and no desire for the particular food. It is not craving, but the normal desire, then somehow rather difference from other food. Sweet prefers somehow rather more. Sour, fish is a strong preference. Egg, not so much, but chicken and curd he prefers more, and milk. The aversion to salty food, especially extra salt, feels food more salty than others and cannot endure it. Intolerance of fatty food, ghee, etc., causing irritation and taste of that fatty food. Bowel habit is almost regular, but feels mentally very cheerful when evacuation takes place with sufficient amount. And now I am continuing once again physical genetics. Sleep, it is cat-nap sleep. The particular term I wrote in the language of Mathematica, but it should not be written like that manner, but as I am presenting before the homeopathic fraternity, what the patient told actually, I am not suffering from disturbed sleep. My sleep is very light. Whenever getting any sound in my room, anyone is passing or opening the door, I wake again. That is the cat-nap sleep we are getting in Mathematica book. Restless, no ease position. Wakes almost every night at about 4 a.m., awakes repeatedly and cannot soon sleep again. A dream of death person as if they are living. Sometimes dream of soiling, sometimes dream of snakes, old visited place with time and space, sometimes sad and anxious dreams also. Regarding perspiration, it is offensive. Dresses also become offensive despite of washing. Extreme of cold and heat is not tolerable, feeling bad. Extreme winter or extreme heat is not tolerable. Regarding bathing habit, regular, even in hill station, he likes to bath. But like lukewarm water in deep winter, never hot water. Even If he have to move anywhere in late night by flight, etc., like to be bathed before going. At about 1 a.m. or 2 a.m., he have to go for bathing. A general tendency likes open and fresh air or air-conditioned atmosphere, does not tolerate more warm clothes in winter, causing trouble, oversensitive to both mental and physical pain.
Huh?
Are you getting?
Yes.
Yes. Now, disposition of mind. Why I'm telling, not telling mental symptoms? Actually, mental symptom incorporates both pathological mental state and positive psychology mental state. In homeopathy, whenever we are considering mental symptom for prescription of any disease condition, the disposition of mind, whatever we are considering in the light of psychiatry or in the light of psychology, they may do not consider these symptoms as a part of their concern. But in homeopathy, we are considering disposition of mind for prescription purpose. So the disposition of mind was desire company, sometimes prefer solitude and silence for self-actualization. Like to discuss and interact or listen spiritual talks, man-making idea, and feeling delighted and enlightened. Feeling pain for common people, but deprived by any means. Feeling pain for common people who are deprived by any means. Tendency to speak with logic and comment. Esteem sense is very high, not for himself only, but others as and when dishonored. Very analogical and rational in thinking, always finds and puts logic for all type of work done. Very particular about thought process and organizing himself, very punctual, calculative, even while donating money, thinks twice whether it will be used for good cause or not. Forgetful about recent topics, but could remember old topics in image and story format. Absorbed when being admired by someone, but no proud or superiority. Expressing personal emotion, occasionally waves. Then mistakes in calculation, reading, spelling words while writing, uses wrong words while talking in casual conversation, and also use wrong words while writing and find himself wrong afterwards. Uses correct words when the topic is serious. Very hurried while writing, especially long words in his own shortcut expression. The spelling of words is here wrong, it should be WO. But he could not read out himself what he has written earlier. Hurried even while eating, sits together to take meal, but hardly resists himself to take the meal first. Like to read and discuss topics with philosophy or anything with a goal for betterment of common people. Sometimes feeling very affectionate, sometimes no affection to close ones. Sometimes feeling very affectionate, sometimes no affection, indifferent. Sometimes avoids own relatives and close person, even family members, prefers to be alone with another known person. Occasionally, amorous patient. Can endure any type of anger and mortification. That is a beautiful quality he is having. Can endure any type of anger and mortification. Grief without expression. That is reserved displeasure he can endure. When anyone hurts, feeling sad, but no anger or revenge in the mind. Always judges things very impartially, irrespective of relationship. Feeling oneness with others, whoever doing or thinking for mankind. All these things, if we say favoring any man, it is very good thing regarding the perspective of positive psychology, but it is very good clue for prescription of homeopathic medicine. One should travel mostly in natural places like sea, hills, old heritage, etc. No interest in luxury town visit, feeling emotional about the nation, never like to compromise with anything that is unlawful or unethical. Once again, I am presenting the video clip. There is still picture of the lake, first visit. Second visit after 4 days. It is after 9 days. After 15 days. Second visit and fourth visit comparison. First visit and fourth visit comparison. Now I am presenting the page from Herring's guiding symptom. How beautifully it was observed by our stalwarts and legendary homeopathic physician, and they noted it. Uses wrong words for correct ideas. Uses wrong syllables. Makes mistakes in writing. Spell words wrong, mixes up letters and syllables, or omits parts of words. The elements from reserve, displeasure, mortification, vexation. Then I put all the symptoms that I got regarding, not particular actually, mental generals, physical generalities, all those things, and comparing all those, the first medicine came lycopodium. But you see in the repertorial chart, the sulfur calcarea carb is also present. So as we are telling during our Mathematica classes, as our stalwarts of Mathematica written in his Mathematica book, there is a trio of sulfur, calcarea, carb, and lycopodium. How true it is. In the same presentation, same totality, we are getting 3 medicine in repertorial chart, depending upon the predominance of symptoms and presenting a complaint, both physical and mental generals and particulars. We are supposed to prescribe the correct medicine, consulting the Mathematica. Now I am telling, whenever I am expressing anything regarding this case, I like to conclude what we get out of the case record. It is the totality of the symptom. What Hahnemann said, it is the morbid phenomena. The morbid phenomena is being noted with the term MP. Then cause of ailments, it may be exciting, it may be fundamental, that is C. And then effect of the cause, that is manifestation in particular level, in physical genetics, in mental level, that is effect of the cause. It may be noted through EC. And from Mathematica, it will be noted through MM. Then summation of cause and effect of the cause. Summation of cause and effect. Why I put the symbol of summation? There may be number of causes. There are number of effect of causes whenever we are considering totality. In terms of mathematics, if we describe totality of the symptom, in terms of mathematics, its symbol, it may be presented in that manner. Summation of cause, that is exciting and fundamental cause, and summation with effect of the cause is equals to morbid phenomena, which is equal and similar to Mathematica. Whenever we are prescribing any medicine, if we satisfy this equation in our daily practice, hardly we fail. What is happening actually, you may ask, in every case, if we match this equation, in every case is curable? No. What is happening? In few cases where the case is incurable, we may get the fundamental cause very clearly, but the effect of the cause is not characteristics one. That is very common to the disease pathology. And from that perspective, the morbid phenomena is not as per homeopathic philosophy. It is not uncommon peculiarity, it is not characteristics totality. And from that perspective, it does not match with Mathematica. But when we're getting fundamental cause and exciting cause, it is very proper from the mathematic perspective of view. And where the effect of the cause, we are getting very clear cut and uncommon peculiar thing from physical and mental generals and particulars with modality and concomitants. It is the true morbid phenomenon, it is a true totality. And that will match with the symptom of the Mathematica. Just I am showing a video as I have a little case in detail, just to see how we are matching Mathematica with the symptom of our patients. You just see, this is a cup without any picture. Whenever you put it on the plate, it will matching with the picture of the plate and it will appear another picture. Likewise, whenever we are matching the symptom of metra medica with the symptom of the morbid phenomenon of the patient, it will match like that. It is the true same, not same. It is similar. It is reflecting like the image of the metra medica we are getting in our patients also. Now I am presenting another case, a case of chronic pancreatitis. A female patient is at about 38 years, was suffering from dyspepsia, vomiting, and abdominal discomfort with pain and burning in upper abdomen with irradiation to back. It is almost common to chronic pancreatitis. Nothing peculiar, sticking sensation and dragging sensation for vagina if something is protruding down without any true genital prolapse. Once again, I am repeating. Sticking sensation and dragging sensation from vagina as if something is protruding down without any true genital prolapse. It was being diagnosed and repeatedly examined by gynecologists. They said there is no pathology or no such thing is there. Then anorexia with constant vomiting is well marked. Patient came from allopathic friends and being diagnosed by CT scan of upper abdomen, oral and IV contrast, and blood biochemistry, which revealed feature of chronic calcified pancreatitis with raised serum amylase 356 and lipase 735. So now I am detailing the patient now. The female patient is about 58 years, consulted me on 1st January 2005 from suffering from following symptom. Whatever already I have told. Then the legacy of the present illness, how it was developed. Initially, indigestion, easy satiety with nausea and vomiting was predominant. Now, she was suffering from constant vomiting, pain in upper abdomen radiating to back and burning along other presenting symptoms. Gastric symptom neither aggravated nor not ameliorated by eating, except acidity, which aggravated after eating. Only acidity was aggravated after eating, no other obvious amelioration aggravation by taking food. Another presenting symptom was started about 7 years ago, and gynecology examined and detected no abnormality, that is, something is protruded per vagina. The patient was very much prostrated and exhausted physically and mentally due to her illness, and also become very much frustrated about to recover, and lastly, surgeon refused to treat her as because the ERCP was not done. She consulted me for palliative treatment. They considered the disease is incurable. Till death, it will continue. Now the past history. Once again, I am going for fundamental cause, if any, for development of chronic disease. That is the past history. Tinea infection during pregnancy and was treated with ointment, jaundice, abortion at 4th month, once without any obvious cause. Family history, father died of cerebrovascular accidents, mother died at old age. One sister suffered from rheumatic trouble, brother bronchial asthma, sister tumor in breast. Actually, the rheumatic trouble, she could not narrate what type of rheumatism she was suffering. Now the physical genetics. Appetite, easy satiety with obstinate anorexia. Feeling emptiness at early morning. Mandate. Feeling emptiness in early morning if she does not take food. Nausea at morning in empty stomach with profound weakness. Almost no appetite during night. As consequences, hardly take food at night. What is happening actually? In early morning, she was feeling very hungry, and if she could not take food, feel very much exhausted and weakness, but no appetite during day, and consequently, hardly she take food at night. Desire for salty food, sour, it is more strong desire, sweet. Thirst is profuse, cold water that gives comfort. Stool, soft or semi-solid stool with frequent diarrhea. Urine, frequent and very offensive. Bathing habit, aversion to cold bathing in winter season. Sleeplessness is well marked for last 5 years. Always want to be covered, but sometimes ordinary clothing become unbearable and kicks off. Though he likes to be covered, but ordinary clothing sometimes causing trouble. General lassitude is all marked, subjective, burning sensation all over the body, especially during daytime, 10 a.m. to 5 p.m. Now the disposition of mind, irritable from slightest contradiction, weeping tendency, whenever telling her complaint, tendency to weep. Nothing mental symptom we get out of inquiry from that patient, apart from those two symptoms. Now I am putting the investigation reports, ultrasonography, chronic calcific pancreatitis. Main pancreatic duct is dilated, multiple dense calculus in ducts. The CT scan is impression is chronic calcific pancreatitis. Now investigation report from scientific research laboratory done by advised by allopathic physician at the then time. The amylase was 356, it should be below 220. The lipase was 736, it should be below 190. After getting homeopathic treatment, the amylase was 54 and the lipase was 14 in different kit. Scientific research laboratory, it is a very reputed laboratory in Kolkata. The blood biochemistry in different day. On 14th December of 2004, it was so high, and 26th February, within almost 2 months, it was dropped down within normal range. Now the anamnesis. The psychosoric miasm was in the background in the disease. If we consider the past history, family history, and the presenting physical and mental generalities. In coordination, excessive secretion suggests for psychosis, and disturbances in uterus in functional level suggest for SORA. Apart from past and family history of the patient pointed to psychosora. With anti-miasmatic homeopathic treatment, as per symptom totality, medicine was administered. From miasmatic basis and proving aspect, similarity, sepia was the choice of remedy in different potency and miraculously acted singly and recovered and ensured. I advised her to repeat CT scan of upper abdomen, but due to poor socioeconomic condition as well, she has no complaint, not investigated till date. Patient is still under my observation. The then time I said actually, and treatment and follow-up, I'm waiting to conclude treatment with an antisoric medicine. Now what proving symptom we got? It is in Hahnemann's chronic disease. Painful stiffness apparently in the uterine region, pressing downward in the uterus, constricting the breath as if everything would fall out. With colic, she has to cross her thighs to prevent the prolapse of the vagina, but nothing precluded. There was only an increase of the gelatinous leucoreal discharge. Keep in mind, this symptom was developed during proving. There is no pathological state in the prover, physical state of health. But the prover felt like that. So whenever we are getting any patient, female patient, having similar symptom without any pathological state or diagnostic parameter favoring genital prolapse, but patient is complaining like that, it is very uncommon, peculiar, along with particulars and first history and family history also corroborate. Now I am presenting another slide from Hughes and Dake, Cyclopedia of Dark Pathogenesis. As I am a man of mathematics, actually, I do like to prefer to present mathematics whenever I am presenting any case. The source book, tired feeling all over, lasting all day, prolapses uterus, inclination to fundus to left side, producing a numb feeling in lower half of the left side of the body with constant dull aching and there in pelvic region. Latter relieved by recumbent posture, especially lying in right side, tenderness in os and uterus. It is also proving symptom. We are getting in Hughes and Dake, Cyclopedia of Dark Pathogenesis, volume 4. The prescription of sepia, 2 dose in PLAS method, in 30 ml, and followed by placebo, and followed by once again in 19th February, we repeated sepia, they were having some symptoms. And after that, in 18th March, the treatment was concluded with sulfur 200. So following anti-miasmatic homeopathic treatment for about 3 months, successive blood biochemistry report reveals normal value instead of raised serum amylase and lipase. And after treatment, it dropped down to normal. So following anti-malmetic homeopathy treatment for about 3 months, excessive blood biochemistry normal. And so a feature of cured chronic pancreatitis and body weight was increased. It was 49 kilograms. Once again, I do like to present the same slide. Summation of causation of disease, that is exciting and fundamental cause, along with effect of the cause, that is the physical and mental genetics and particulars with uncommon peculiar characteristic symptoms, is equals to morbid phenomena, that is similar, not equal, but similar to meteor-medica symptoms. Just I have little 2 cases from my brief and today's session. And now I do like to conclude and pay my thanks and gratitude to especially Professor Akhilesh Khan, Dr. Karthik, and all those persons, those who are giving all the efforts and bearing all the pain to organize this type of webinars, not throughout the nation, throughout international display through YouTube and all those things. It's my pleasure to be with you at this evening. Thank all of you. Namaskar.
Thank you. Thank you. Thank you. Thank you, everybody. Dr. Biswajit, please stop your screen sharing. Stop your, okay, thank you. Thank you.
Already I have stopped.
Let me go through. Now stop. Now stop.
Now I'm also stop my video.
Now stop. Yes. Okay. Dr. Soor is there. Biswajit, stay with us. Biswajit, Dr. Soor, please go through the chat box. Please go through the chat box. Dr. Subhamoy Ghosh has put down some questions. Please give the reply of that questions. Now all the questions have been omitted from my chat box. You please go through yourself and give the reply. Dr. Subhamoy Ghosh has put down some question. Dr. Soor.
Okay. I am observing. Why do not you publish the case of
Few laboratory evidence are required to substantiate before study CT scan of the bone structure, basic crystal bone, mass culture of bacteria, CBC, and CFP.
Any question, please chat.
Why do you not publish that?
Dr. Subhamoy Ghosh has put down some questions for Dr. Soor.
Do not you publish that is a
Please reply.
Essential component of the EMB clinicians like you should contribute the science of the homeopathy. Yes.
I have a YouTube channel. They are all the COVID.
Okay.
I treated 50 cases of COVID cases with reports and data.
Okay.
Yes, Shubhamoy. I also, there is so many COVID cases are there, but problem is that, that some cases are, there may be the false positive, and sometimes there is a dispute cases are there. So for every case, and I have told that cases about he is superstitious about the COVID, that cases I had seen through the online session, not in front of me. So sometimes all cases will not be possible to check or to test for the testing. That's why, but I will try my best. And the second one is there's the
Okay, okay.
osteomyelitis. Okay. And second one is for the osteomyelitis. Your question is a correct one. There are studies there, but there is no some problem was there, but no such gravest problem. But but the osteomyelitis is evidence and
Yes.
it is proved. And okay, but I have not in my hand in the cases, but reports are there. So that's why I am not expressed, or I am not show you. But it was a case of osteomyelitis, and I have done the reports, and it was proved. It is a case of osteomyelitis. Okay.
Any doubt about it?
But
I will question you, Dr. Shubhamay. Any doubt about it? About it?
Dr. Sumoy, please chat.
That
Please,
case was
Sumoy,
that
chat.
case was
I think
osteomyelitis. Any doubt
I
about
think there
it?
will be no doubt.
And I think after seeing the case, after seeing the evidence, after seeing the pics, you must know. And there is a on the video aspect, no, that the patient's video aspect, the case reports are there. So I can't show you the video because it takes so much time. That's why I can't show you the video. But the video,
We have all reports. We have all reports.
in the video aspects, the reports are there.
Okay, okay.
So
Thank you. I think Dr. Sumoy Ghosh is satisfied. Dr. Sur, I think Dr. Sumoy Ghosh is satisfied with reply. Dr. Sumoy has replied, no question of doubt, it should be published. He's telling that your case that should be published in peer-reviewed journal. Okay, he's telling Dr. Sur, Dr. Sumoy is telling about the publication of your cases, those who have cured by you as clinical cases. In future, you please publish in the peer-reviewed journal. And that will be better for the future generations as an authentic documentation for proper documentation. And please publish in the peer-reviewed journal what Dr. Subhamoy Ghosh is telling. He has no doubt about your presentation or any other things what you have said just few minutes back. Just he has mentioned that please publish in the peer-reviewed journal. Okay, I think Dr. Sur will take all the possible steps for publication in the peer-reviewed journal in future. Thank you, Dr. Kullan Sur, Dr. Monjira Sur. Please stay with us. No question for Dr. Biswajit. Only Dr. Subhamoy Ghosh has mentioned that one Dr. Siddhartha Mukherjee from Calcutta, Siddhartha Mukherjee has put down some questions. Dr. Subhamoy has in respect to Dr. Biswajit Basu, commendable presentation and praiseworthy of your innovative mathematical model you have taught your students. Mathematical model. Okay, very good. Siddhartha Mukherjee's question to Dr. Su. Writing is very good, but later mainly theoretical analysis picture. What Dr. Basu for you? Dr. Basu for you, Dr. Siddhartha Mukherjee, another practitioner from West Bengal, renowned practitioner. He is also always try to attend in our seminar. He's telling that your starting is no question, just his observation during your oration. Starting is very good, but later mainly theoretical questions. I think Dr. Basu will try. Basu theoretical analysis as per his version. He's telling me the theoretical analysis. Basu, please reply.
Most welcome.
Dr. Basu, can you hear me?
Yes. Most welcome, Dr. Siddhartha, for your kind suggestion. Actually, whatever I told in deliberation, nothing is to impress anyway in early part, in latter part in different way. Whenever I am supposed to present any case, as I am presenting with all investigation reports and whatever patient told, I have written all the things in detail. It may appear to you it is very theoretical, but I am sorry to say, if we not detail all those things in theoretical manner, it is not possible to present all the videos in seminars, and it is very monotonous. Whenever we are presenting detailed video for half an hour, when patient is telling, participant is not waiting for the video speech from the patient. From that perspective, actually, I have detailed all those things in theoretical manner, but whatever I deliberated from that theoretical perspective and theoretical writings, that is from the practical and applied aspect, from what symptom I select the medicine, what was the mathematic background, why I consider the mathematic background, in what light of the philosophy I have considered the medicine from the perspective of mathematica, proving records, and apart from how we can analyze the case from past history and family history from fundamental cause of point of view. All those things I have elaborated depending upon the theoretical deliberation what I have put it in slide. Actually, it is not theoretical. Moreover, I could remember it. I will keep it in mind whenever in near future, whenever I will present anything, it will be more practical. Thanks, Dr. Siddhartha.
No, it is practical presentation, no doubtly, because most of the viewers are students of my college and other college. So practically it is practical because of that the practical experiences is needed to be theoretical interpretation. Because when he has referred the chronic disease, other things, that why he has taken given importance of the sepia for the symptoms, the reference is always needed. So it is nothing but the practical, no question of theoretical explanation, but the theoretical interpretation of the practical experiences. Dr. Siddhartha, I think you are satisfied with my supplementary answer as added to Dr. Basu. Dr. Siddhartha is also very genius, always attend our seminar webinars from very remote places of West Bengal, good practitioner. Thank you, Siddhartha. Thank you, Dr. Soor, for joining with us this beautiful webinar. Now our room is full. Most of the people from Bangladesh, and other part of West Bengal, also from Antar Bharati, Nagpur, and some part of the Srinagar people also join here. Now I request Dr. Jyoti Gajbe to open his audio and video. Jyoti Gajbe, please open your audio and video. Jyoti Gajbe, can you hear me? Karthik?
Yes, sir.
Can you hear me? Dr. Karthik?
Hello,
okay,
sir.
open your audio and video.
Sir, am I audible?
Yes, we can hear you.
Okay.
Yes, audible, not visible.
Only audible, not visible?
Not audible, you are audible, not visible. You please try to open your video.
No, she is visible.
Sir, it's open.
Visible.
Visible, okay. Now please go through the validatory session. Now is visible to me. Now you are visible to me. Okay, please go to the Dr. Jyoti Gajbe is a assistant professor of Department of Community Medicine of Antar Bharati Homeopathy Medical College. Already principal madam has joined with us in the participant list. Already she has inaugurated this session, particular session. So Dr. Principal madam is listening us from panel list. She is not now host. Now the doctor, she has been Dr. Jyoti Gajbe has been allowed to speak valedictory session. So Dr. Jyoti Gajbe, Assistant Professor of Antar Bharati Homeopathy Medical College in the Department of Community Medicine. Please, Madam, go through. Please go through your lecture.
Thank you, sir. A very good evening, all of you.
Okay.
First of all, I'm very thankful to our respected principal, Dr. Sumbha ma'am, who gave me this opportunity to give vote of thanks for today's webinar. Firstly, I want to do I'm very thankful to our lovable and respected director, Dr. Bhausaheb Zite sir, without which support and without their permission, this webinar will not be possible. Secondly, Then I am very thankful to Dr. Monjira Sur ma'am, the president of the School of Homeopathic Mind Technique, and she gave their experience of how deal with the surgical and medicinal cases. She also explained us very beautifully how to found the mind rubric, and which is very challenging, and especially this is very challenging to the new students, which will start their practice. Then I thankful to Dr. Kalyan Sur sir, the founder of the School of Homeopathic Mind Techniques, and their presentation on the multi-organ failure. And this is really the big challenge for the homeopaths. But sir make it very easy for the practitioners and how to tackle the multi-organ failure cases. And sir also explains uh, in multi-organ failure cases that select mind rubric and especially on the gestures. And most of the in multi-organ failure cases, most of the physicians they use like a palliative line of treatment or the drainage remedy. But sir told us that how to take this simple rubric and from which the patient will be treated or cured. Then third, I thankful to Dr. Biswajit Basu sir, who is the chairman of the Bengal Academy and applied homeopathy and faculty also, who gave us a knowledge on bedside clinical experiences. Sir gave detail. Sir gave these cases in detail, and really this is very helpful for us, sir. And sir, your mathematical expression, that is summation of cause plus effective cause equals to morbid phenomena, it is very helpful for us also. And this detailed case taking, which you means how to take the case taking at bedside also, this is very important for the practitioners, as today so many students are joined there who are in the internship. For those, this is very important. Then lastly, then I thankful to our team that in I thankful to our ex-principal that is Dr. Gore sir, who is the convener now. And then I thankful also to our medical superintendent sir, Dr. Babat sir. I am very thankful to our new principal, Dr. Sumha ma'am. And I also thankful to the Mr. Karthik Raghumurthy sir, CEO of the Bahula Foundation, who gave us the digital platform to us for the webinar, and also for conducting live webinars on the YouTube. And lastly, I thank, of course, to the Professor Dr. Akhilesh Khan sir, the mentor of our webinar. Because of you, sir, our webinars of AHMC Nagpur can be attended at the national and international level. And without your support, we cannot find such a high level speakers from them. We can learn many things. And because of you, sir, because of you only, our webinars are on the national and international level. Lastly, I am thankful to to my colleagues, and of course to my dear participants and to my dear students. Thank you, sir. And lastly, I wish all of you a very happy new year. Thank you.
Thank you, viewers. We have some announcement. In long run, we will also invite Dr. Kalyan Sur and his team, along with Dr. Manjira Sur and Dr. Biswajit Basu, for in our webinar, exclusively with them, exclusively for 2 hours to 2 hours. After contact with Dr. Karthik, we will contact a separate webinar with the Sur's team with the mind technique, and another webinar with Dr. Biswajit Basu on another day, not in a single day. That will be very difficult because of the time. So we'll try to provide more time for Dr. Kalyan Sur in your future after discussion with you. And also Dr. Biswajit Basu will talk with different clinical cases in your future research seminar. So this is the last webinar in this 2020, the Corona year, Corona and COVID year. So coming year, I think it will be free from Corona. After the introduction of vaccine and others, also introduction of our homeopathic challenge for no sorts. because of the Rajasthan is doing well with the nosods. And in future, I think nosod will come in the market, and that is approved by government. And also we have requested Dr. Rajeshah, and then when the nosod will be prepared, the Kartik, that is the Bahula Foundation, should allow them to prepare the nosod, COVID-19 nosod, with the help of Dr. Rajeshah. So this is last post Christmas, or there is a Merry Christmas to all of you. We are planning to do another webinar in the 2021 with student talent search. And in 2 days, after discussing with Dr. Kartik, we'll announce the detailed program for our next webinar series in the 2020 year, with a view to free Corona, free from pandemic. And the 2020 will be the year of homeopathy. So thank you everybody, Dr. Sur, Dr. Basu, Dr. Manjira Sur, Dr. Kolla Sur, Manjira Sur, and special thanks to
all of you.
Dr. Kartik.
Happy New Year.
Happy New Year all of you. Happy New Year. বাংলাদেশ থেকে প্রচুর লোক এসেছেন, বাংলাদেশ থেকে a lot of people. The room is fill up. Bangladesh, most of the Bangladesh people. আপনারা ভালো থাকুন, সকলে ভালো থাকুন। বাংলাদেশের যারা জয়েন করেছেন, আগামী দিন ভালো আমার ওয়েবিনারে আপনারা জয়েন করেন। আমরা লিঙ্ক পাঠিয়ে দেবো ডাক্তার সুরকে এবং ডাক্তার বাসুকে। আপনারা জয়েন করুন। অনেক ভালো ভালো স্পিকার আমাদের কাছে আসে, তারা তাদের বক্তব্য রাখেন। আপনারা ভালো থাকুন, সকলে ভালো থাকুন। খোদা হাফিজ, নমস্কার, সালাম, স্যালুট, আসসালামু আলাইকুম। থ্যাংক ইউ এভরিবডি। থ্যাংক ইউ। হ্যাপি নিউ ইয়ার।
Happy New Year, sir.
Happy New Year. Kartik, you can delink the
Yes, I'm going.